Morning, good morning, good afternoon. Welcome to all the participants to this webinar session organized in the context of the third launch of the e-waste challenge massive open online course, MOOC. This session will focus on e-waste and children health and the exposure, the human exposure to e-waste. My name is Francesca Ceni and I will facilitate this session on behalf of the BRS Secretariat, as well as providing an introduction to the 2025 version of the MOOC. In today's session, which is scheduled to last for 1 hour, after an initial introduction on the e-waste challenge MOOC, Marie-Noël Bruné will introduce the latest knowledge on e-waste and children health for about 30 minutes. And this presentation will be followed by a Q&A session for about 25 minutes. The presentation and the recording will be posted on the webpage of the webinar session on the webinar pages of the Basel Convention. It is my pleasure now to present the learning path and the courses which are included in the e-waste challenge MOOC. I will now share a presentation. I hope you can see the presentation, maybe not in full screen now. Yes. So the e-waste challenge MOOC was developed in partnership between the BRS Secretariat, the EIT Raw Materials, and its academy, and the University of Leuven in Belgium, the International Telecommunication Union, the World Resources Forum, and with the collaboration of the WHO, particularly in the course on e-waste and children health, which will be introduced today. The MOOC includes a learning path in 5 short courses. Learners can enroll only in one course or in all the courses they are interested in, from the 1st to the 5th course. But let's see what you can find in these courses. In course 1, in the e-waste challenge, you will find an introduction to the issues, the impacts, and the solutions. In course 2, it's the course we are introducing today on e-waste and children health. You will find the latest knowledge on exposure of children, vulnerable populations, and human health in general in relation to e-waste. In course 3, you will find solutions through policies, standards, and business solutions, especially looking at how to reduce e-waste by design from the product upstream, and how to develop policies like EPRs and what are the case studies, the experiences in this area. Course 4 includes sustainable e-waste recycling practices, and it includes experiences from tracing the extraction of secondary metals from e-waste, and it shows what are bad practices to avoid and good practices instead to adopt in the business of recycling of e-waste. The 5th course is the last one, and it focuses on e-waste management, standardization, and conformity assessment. It introduces several standards for e-waste recycling facilities and how to evaluate the performance of recycling facilities against these standards. So join us and take the MOOC. You will find it at this webpage, and also on all the messages that you have received on the live events. And now, after this short presentation, I pass the floor to Marie-Noël for a presentation on e-waste in children health. Marie-Noël, you have the floor.
Marie-Noël, we cannot hear you.
You are muted.
Sorry, I was on mute. I am putting up the presentation. Just give me a second. And I'll be right with you. There we go. I hope everyone can see my screen now. My name is Marie-Noël Bruné. I work at the World Health Organization, and I wanted to thank the Basel Convention Secretariat and also all our partners in this massive online course for inviting the World Health Organization to speak today. And I wanted also to thank every one of you for taking the time to share this webinar time with us and learn a little bit more about electronic waste and the challenges that it presents to children's health and also to health more in general. I work in the department that deals with environmental issues at the World Health Organization. I am a molecular biologist by training. In our department, in environmental health, we all have very different, we're not just medical doctors, we all have very different backgrounds and expertises, because when you deal with environmental health, you really need to come with different kinds of solutions and you need to look at the problems from different angles. I work specifically in the team that deals with chemical safety and radiation as well. And we are the department that deals mostly with the prevention side of WHO. A lot of the World Health Organization deals with curing diseases, you know, with vaccines, with what can we do about infectious diseases, what can we do, about different kinds of conditions. We are mostly interested in preventing these conditions from even happening. So, you know, so we think that something like electronic waste, which is the kind of waste. So we have a team actually in our department that works on sanitation, hygiene, and waste. And actually, electronic waste is the kind of waste that is ever rising at the moment. And we realized for a long time that the world didn't know, at least the health world didn't know that it had a health challenge related to electronic waste. And that, you know, this was not just about, you know, all the wonderful things that technology brings us and that are so necessary for our everyday life, but there was the other side of the coin, the hidden side of the coin, where all of this was being recycled in a manner that was actually affecting the health of a lot of people and communities, and children. We'll see why in particular. So I am borrowing a little bit the statistics. You probably all know them if you've read a little bit about electronic waste. They're produced, you know, by the Global Monitor and UNITAR, colleagues in UNITAR and other UN agencies, the Global Statistics Partnership. And as we know, you know, there's a lot of e-waste being produced in the world, 62 million tons. You know, and it's constantly going up, and we predict it will continue going up because we keep using our cell phones. I mean, you know, it was predicted that that a European uses about 30 cell phones in its lifetime, and probably, you know, it will be more in the future. We also know that this, you know, a lot of the electronic waste doesn't really get recycled like it should, but is often like shipped to other countries or to other regions. For it to be torn apart, because sometimes, you know, recycling in a proper manner is very costly, and so sometimes it gets sent as donations, as fake donations, and so there's a lot of illegal trade around it, which is why it is so important that we can work with Basel Convention, you know, that can define what waste is and isn't, and you know, and how this trade should happen or shouldn't happen. And then, you know, we know there's a lot of flows coming from high income to low and middle income countries, but we also know that within regions themselves, there is flows, you know, across countries and across borders that go from electronic waste. So it's a highly complex thing, and it's not so easy to solve. From an environmental point of view, we know that there's over 1,000 chemicals identified in electronic waste, and many more. This number keeps going up. Among those, we have, some of the really, really bad guys, or like some of the heavy metals like lead. Lead is really something we have been working on in the World Health Organization for many years. They actually think lead was one of the reasons why the Roman Empire fell. They were adding lead to the wine, the water pipes, and so, even today we have not been able to solve completely the lead challenge. And we know there's a lot of lead that still remains, that is present in electronic waste. So it is not so much a problem if it is in our electronics, but it becomes a problem when those electronics are not recycled properly. So we also know there's cadmium, there's mercury, there's a lot of persistent organic pollutants. So these are chemicals that are in our waste and then persist there, persist in our environment. Once they're out in the environment, they stay in the environment for a long period of time. And most of these chemicals are toxic to human health. We also know there's polycyclic aromatic hydrocarbons, which are combustion, which come from incomplete combustion. And these are harmful to human health. We have brominated flame retardants. We have plastics. There's a lot of, plastics is something that right now there's a lot of talk about plastics and microplastics, and, they degrade into even smaller particles, and they can reach almost every organ in our body. So, so basically, as someone said, electronic waste could basically be a little bit like pick your own poison, so there's a lot of this terrible things and others inside electronic waste. And we know that also there's a lot of very valuable materials as well. And we keep having the thing with electronic waste is that, it's a very varied kind of waste. It's and it keeps changing all of the time. We have now electric vehicles, we have, e-cigarettes, and they keep changing and the models keep changing. So we also have new threats that keep coming up as well. So as I was mentioning, we are mostly worried not so much about the electronics themselves, but about the way, most of electronic waste doesn't get properly recycled. And so, there is all these different techniques actually that kind of really harm the environment around them, but also harm the human health of the people who are living in those environments. And sometimes they're not even involved in the electronic waste recycling themselves, but just by living there, they're highly exposed to these materials. So we have, we have dumping, we have burning. There's a lot of burning that goes on, especially of cables, because cables have copper inside, and copper, even though what you retrieve after burning cables with copper is secondhand copper, it still can sell quite well in the black market. So there's a lot of, like, you can see bonfires where they throw all these different cables inside to retrieve the copper. And the copper has, of course, plastic around it, which is volatilized and, and it's very toxic for breathing. But you also have often lead that is inside the cable as well. And we have now statistics, for example, from different places. We have our pediatric environmental unit in environmental health unit in Montevideo in Uruguay that reported, I think the statistic was about 80% of the cases of lead. And they have traditionally a lot of lead intoxication problems in Montevideo, traditional ones, but today, most of them of children having high blood lead levels in the blood come from this burning of cables, from this electronic waste recycling. So what they call urban mining is one of the biggest lead problems that we have today. This, by the way, this week in WHO is our lead week, or like more like International Lead Poisoning Prevention Week, where we do a lot of activities and we ask countries and we ask different academic societies, universities, doctors, whatever, communities, whoever wants to do events or any kind of happenings around lead to give visibility to the problem. So this e-waste is definitely one of the huge problems we have nowadays with lead poisoning and lead intoxications and lead exposures. So So we have burning, we have leaching, we have cooking also of the circuit board, we have shredding, we have dismantling. So there's not only all the exposure to the different chemicals, but we also have potential for injuries. Children are often used in this kind of operations because of their small hands. We can see also children here playing around in the waste sites themselves, because what is a waste site but a wonderful playground for a child, right? If it's there in the community. So one of the reasons why we focus so much on children is, well, there's many reasons. One of them is because we work very closely with the International Organization for Workers, so the ILO, the International Labor Organization, and they focus a lot of the work and the prevention that they do on workers. And also because we know today that, you know, children are not little adults, and so children are exposed to many of these compounds in a way, you know, the response of their bodies is very different from that of adults. So they have a dynamic developmental physiology, which means that their organs and their systems and their bodies are developing. So a child, for example, that is exposed to an amount of lead, you know, a very young child of about 2 years old will absorb about 80% of that amount of lead, whereas an adult maybe around 5%. So, you know, there's a huge difference. There's a huge difference in the way, and the impact will be much bigger, of course, because their organs are developing. So, you know, the disruption in the development, the disruption in that healthy, in that future healthy, in the health of that organism is much stronger. Children are also going through these windows of vulnerability. As organs develop, they are particularly vulnerable to whatever external agents that can or external messages, you know, from foreign chemicals that can happen at those moments. And we know today that the placenta, for example, is not a real barrier. So many of the chemicals, even when we're in utero, when we haven't even entered the world, if we're exposed to some of these chemicals in any ways, we will still have the impacts, you know. We also know children have their own behaviors, especially they put, you know, many objects and their hands in their mouth all the time. So a lot of this electronic waste informal recycling, you know, some of it appears, you know, some of these chemicals end up as dust, you know, in our houses, in our surroundings, in our communities. As I was mentioning, the example from Uruguay, you know, what you see after the burning of the cables is big black stains on the ground that are, of course, because of the burning, but are also because of the lead that remains there. And that, of course, you know, if it can, you know, get into your body through different ways, but if you put it directly into your mouth, it's, you know, a very direct put. And so a child breathes very close to the ground, and that's, you know, when these chemicals volatilize, that is, you know, the most concentrated area. You know, the same for mercury and most of the chemicals. So, you know, they also have their own very specific behaviors. A teenager, for example, doesn't measure risk in the same way as an adult, you know, so probably thinks they're more invincible in a way, you know, maybe this will not happen to them necessarily. They also have very unique routes of exposure, you know, which is, I mentioned the transplacental route when they're in utero. There's also, you know, a lot of these chemicals that are lipophilic, so they actually bind to fat, you know, and so something like breast milk, which is full of fats, you know, it goes to the unborn to the baby, sorry, as she or he is being breastfed, and there's a lot of, you know, that's a big chemical route. Of course, you know, breastfeeding is something very important, so it shouldn't just be stopped, you know, because we have a lot of, especially we have a lot of immune benefits and you know, of health benefits that come from breastfeeding, but still those chemicals, you know, go from our bodies, can go from our bodies into the child, being unborn, or through other routes. Like breastfeeding. So anyway, they have their own behaviors. They also have a longer life expectancy. So whatever they're exposed to, they have many more years to develop a disease. Diseases like cancer that sometimes takes dozens of years to develop. Well, they do have those dozens of years ahead of them, you know. And then they are vulnerable sociopolitically because, you know, a little bit like the child in this photograph, you know, who is, you know, in a chair and you know, and that's the place that the adult puts the child. and you know, they are dependent on adults, and they are a little bit dependent on the world that we create, and you know, the places where we decide that they live, or where we can have them live. So you know, so they don't have their own voice. Of course, they have it later on in adolescence. We've seen, you know, all these adolescents marching for climate change, but at a very small age, it is mostly the adults who decide for them. So this is an infographic that we created. We have, I'll mention this later, we have a very big initiative in the World Health Organization on electronic waste and child health, you know, that we developed with our collaborating centers, and also with the support of other UN agencies, and also Basel Convention, and other international organizations. And so we developed a series of infographics that are available in different languages for everyone to use. And so, you know, anyone who wants to put forward the message of health and electronic waste can have easy information that they can share with others. And this is one of them. And I think it shows very easily what I've just said, you know, how children are exposed to toxicants through their skin, through the air that they breathe, you know, the air, even if e-waste is recycled here, the air, you know, can be transmitted, you know, you can still breathe something elsewhere, and it also carries the dust. Ingestion, of course, of food, as I mentioned, you know, a lot of the food, you know, some of the food that could be of animal origin, for example, the fat could be very heavily concentrated with these chemicals, but of course they're everywhere. They're also, you know, they could be in the vegetables, they could be in the rice, they could be in the water, in the dust that settles everywhere. And of course, as I mentioned, the transplacental exposure. We know that, for example, lead gets associated with calcium in our bones. And so when a person is pregnant, it gets released from the bones, and just as calcium actually, and it gets recirculated in the body. So it is, you know, that child is again exposed to a big amount of lead if the mom was exposed to a big amount of lead and has a big amount of lead in her body. So it's a very vulnerable time, the pregnancy time. And in a way, this makes it a little bit of a transgenerational kind of problem, because the lead that we have in our bodies, gets recirculated during pregnancy, and we pass it on to our children, and you know, this becomes a cycle. So as we said, there's different sources and settings of child exposure. For example, one of them, and you know, is child labor. There's children working. You know, we've seen reports children as young as 5 years old working on electronic waste, because they have little hands and they can easily take the components out. And of course, you know, they're exposed to horrible, you know, chemicals and toxic agents, and also toxic fumes. Child labor is something that is recognized by the International Labor Organization. They have a series of conventions and of laws around this, that it should not be allowed. It should be banned. Children should not be working at certain ages, and they should certainly not be working in hazardous conditions. This often happens, you know, in home-based recycling practices, you know, parents who often don't have another means to make an income, or living in neighborhoods or in places where it's very hard to do something that is not illegal or something, see electronic waste recycling as a legal way of making an income. And so, you know, they do this inside the home. So you see this big piles of electronics actually, and they do this e-waste recycling at home, which means the child is highly exposed. I have visited some of these homes, and I have even seen, like, sometimes I've even seen one home where the bedrooms of the children were separated by lead battery piles. You know, that was the walls were batteries, and the little yard was so crammed with different, you know, with piles of electronics, that they didn't even have, you know, places to play. You know, they were hopping around from electronic to electronic, which the injury, you know, on top of all these chemicals and heavy metals they were exposed to, the injury risk was huge. So, but you could see that at the same time, you know, all the social problems and everything. It was, you know, very difficult situations, but still, you know, that's one of the settings where they're exposed, is sometimes these home workshops. The pollution, of course, in surrounding environments, where there's landfills, where there's e-waste, when e-waste happens in the community. Schools sometimes are close to e-waste recycling sites. One of the first reports we had of the impact on children, of children's health, related to electronic waste, came from studies in Thailand with our collaborating center in Thailand. And they were studying the lead levels of children living in schools where there were, e-waste recycling happening nearby, and those levels were high. So anyway, air, soil, dust, food, surface water gets contaminated. So, I have here a statistic in 2020, around 16.5 million children are working in the industrial sector. So just to give us an idea of a number. I mentioned a few of these settings and scenarios already, homes, places, communal places, community places where everything gets burned. And this is a map of a few countries where we know there's hotspots, because I think e-waste comes, when we mention e-waste, for those who know a little bit about electronic waste, we immediately imagine like big hotspots, big places where they recycle a lot of, like a little bit like we can see here, like community picture, in Africa. And so we remember that town in Ghana, about Glosio. We remember, the one in China, or the one, in different places of the world where there were big towns actually doing this. And that's the image that we have. So here in this map, we just, out of the literature, we saw which hotspots had been reported, and we put them in the map. But when you look at the map, you kind of say, hey, there's a few hotspots, but this is not really a global problem, because there's just, a few countries with hotspots. But the reality with electronic waste is that I think every country in the world has an electronic waste problem, because it is very insidious, because it happens in communities, in poor communities, in the neighborhoods, and in the poor neighborhoods, when, this is part of like the other activities, sometimes illegal activities, sometimes prostitution, sometimes drug trade. And, and there's scavenging, there's recycling, and as part of that recycling, there's also e-waste recycling. And sometimes you can read a sign that says, I will buy everything. I will buy, all the electronics. I will buy old printers. I will buy metals or whatever. And all those places are places where e-waste is being recycled. Sometimes they even knock on people's doors and say, do you have any old toaster or anything that, that doesn't work anymore? We'll take it, we'll take everything. So, this happens in a much more insidious way probably in every city and in every country. So even though there's a few hotspots that have been reported, this is definitely a problem that happens in every place in the world. So we did a very big report in 2021 in the World Health Organization, where we analyzed all the literature. We were based on 2 systematic reviews, and we analyzed all the literature that had been published on the effects of on health from electronic waste, and we focused specifically on children. And this is another one of our infographic that kind of sums up these effects, adverse birth outcomes, DNA damage, the way our DNA gets translated and gets expressed, is also affected by some of these components in electronic waste. Changes to the immune system, to the cardiovascular function, to neurodevelopment, as we saw, some of these heavy metals and other components are high neurotoxics, so they are actually affecting our brains and our brain development, So when you take this at a population level, it is a very serious matter. It is a serious matter at an individual level, but a whole population that's exposed, a whole community that is exposed to this, the Gaussian curve of their IQ, is really being shifted to the more intellectually impaired instead of being shifted to the more brilliant ones. And so in a way, when you have a poor community, you would really want them to shift, you wouldn't want them to shift to the more, you would want them to have, better opportunities in the future and to be able to do better and not necessarily have those brains being impacted and being stunted. Changes in thyroid function, in lung function, and of course, increased risk of diseases later on in life. So as this, I'm going to go a little bit quickly here. I invite you all to go to the massive online course, because there you have this whole course on health, and there you can find a lot more information on all the different health outcomes, and also a lot of case studies from different parts of the world. So we know that, you know, at birth, we have preterm birth, low birth weight, stillbirth, shorter gestational age, reduced Apgar scores, which are like kind of tell you a little bit the overall health of a child, you know, linked to maternal exposure during, of electronic waste recycling. Also impacts, as I said, on your development and behavior, behavioral changes, learning deficits, you know, reduced cognitive and language scores, respiratory and immune impacts, increased infections and allergies. We also have other health outcomes that I mentioned, you know, thyroid disruption, cardiovascular changes, long-term risk of chronic disease. And I mentioned this one before, you know, so you may see no direct impact, you know, on the child or, you know, when they're being exposed, but these diseases, you know, may take years to actually come up and may manifest later on as chronic diseases. So you may get a cancer, you know, in your 40s, or other times, or a cardiovascular problem or another kind of chronic disease that is actually related to that early life exposure, but it's much more difficult to link because it's more insidious in a way. So I think this is what's really important, and I think, you know, in the World Health Organization, our main public is the health people, is the health actors, being minister level, being, you know, at the doctors or nurses or community, you know, clinic, or being, you know, the primary healthcare practitioner, being the medical student. You know, our main target is the midwife. Our main target is the health people. But here with this kind of problems, our target is still the health people. But we need to find ways to work with all the different sectors, because we don't have the solutions on our own. It's not the same as saying go and you know, and this is the vaccine that should be given for this disease, or this is the medication that should be given for this disease. This is about prevention. So we really need to work, you know, at a policy level. We need to work with other agencies. We need to work with other ministries, with other sectors. And so I think the big challenge for us in health is to really be able to empower the health people so they feel equipped. First, they understand that they have a problem, you know, electronic waste is really impacting health, but also that they feel equipped to be able to, you know, to move on and to work with all these other sectors. And we do the same internationally. That's why we cannot solve this alone in the World Health Organization. We need all the other agencies. We need the other international organizations and conventions. So these are some of the solutions and actions that we can take. Of course, eliminating child labor. There shouldn't be child labor. There's no excuse. I know these communities, you know, it's often their only means of income, but they should be working on something else. They should be accompanied, you know, at government level, at community level, or something, to work on something else, or to work on safer practices. But children should definitely not be working with electronic waste. Maybe there could be a community workshop instead of a home workshop. There's a lot of solutions, and there's actually agencies or NGOs that work on those solutions, but children should not be working on electronic waste. It's a child right to live in a healthy environment. Promoting community awareness, of course, you know, and take back systems, incorporating policies that protect health. You know, in all policies, there should be health protective targets. Of course, you know, providing funding and research, because with research especially on solutions, you know, that's what's so important right now. We know, you know, there's a lot of poisons in there. We can go on finding out about the different poisons, but what we really need to know now is more and more about what really works, and share it among different countries and regions. Signing international conventions and making sure that they're actually applied at country level, and of course, promoting this in the work. So for the health sector, this means, you know, become aware, understand that e-waste is not just your electronics, it's not just your electronics, you know, people dumping their electronics into the waste or whatever, and it's impacting health. So become aware, become informed, recognize where e-waste exposures happen. You know, if you're a community health worker, you can see in your neighborhood when this happens. When you do your visits, you can identify, you know, where this kind of practices are being held. You know, you can diagnose and treat if you work at a clinic. You can take an environmental history, which means asking a few questions. You know, you can develop sentinel surveillance, advocate for safer practices. You know, there are, you know, like cut the cables instead of burning the cables. raise awareness, prescribe solutions, do research, and lobby policymakers, because we need solutions at all levels. So for example, if you see a patient, when you see a child that comes, at community level or at the hospital, you see a child that comes with a mother, ask 1 or 2 questions about, do you know about any pollution problems in your neighborhood? If someone burns cables, recycle materials. Sorry, my computer is about to restart, so I need to make sure that it doesn't. Yes, do you know anyone who has high blood levels? And then prescribe solutions, remove your work clothes when you arrive home, wash them separately, maintain good hygienes, ventilate. And there's a lot of things, and there's many more if you go, I invite you once again to take the MOOC. There's also actions that you can take at local level and that you can promote at a local level, have designated areas for recycling, collection days, the importance of education. I think information is so important because we often, there's so much information out there. We really need to prioritize these messages, safer practices, the 3 R's, reduce, reuse, repair, involving the younger people. We've seen with climate change, I've been in WHO for a long time. And around 2008, 2010, we had this big World Health Day and a lot of things on climate change because we realized now, remember, that the health sector didn't know that climate change was a health problem. And I remember our Director General at the time, Dr. Margaret Chan, she put, she did this huge presentation and, in front of the ministers of health and in front of the whole world. And she put the picture of a polar bear to everyone. And she said, you people think this is the face of climate change. And then she put the picture of a human being, of a child. And she said, but this is the face of climate change. It's not the polar bear, the face of climate change. It's the child, it's the human being, the face of climate change. We are the ones suffering the impacts. And now it's difficult maybe for us to imagine that maybe 10, 15 years ago, we thought climate change was a problem just for the polar bears or for, and this is the same. I think we really, really need to, I think children today, we saw it, with the children with climate change. And I think children today can be a stronger advocate, once they understand what is happening to other children in the world, the impacts that this has in our health. I think, they can actually be a stronger promoters. So again, having youth as advocates, having school programs, local campaigns, making them aware. And here we have a poster that we did at WHO, and that is again in our website with all the infographics. Having national actions. So again, as I said, enforce e-waste laws, eliminate child labor, integrate health protection, monitor sites and communities. If we don't have data, numbers, if we don't have numbers, the problems don't exist. So it's so important that we keep having numbers and we can report this, develop interventions, educate policymakers and healthcare workers. That's why the child health message is so important, because everyone has a child, everyone has a niece or a nephew, or everyone has, when you talk about children, it is different. When I visited e-waste communities, these are communities that are very protective. They know that they do something that is somewhere between legal or illegal. They do other illegal activities. They don't want to be visited, but when you come in and you ask about the health of their children, but because the health of their children is often compromised, about, they're exposed to lead and to so many things. That's when the doors open. That's when all of a sudden, they want to talk, and we have, and the women living in these communities, the mothers, they're big agents for change, they're the ones also opening the doors. So we need to educate them to make a change. And so I am finishing now with the international action. So we have a lot of different conventions, including the Basel Convention. We have a lot of different international organizations and international initiatives, like the e-waste coalition, which is different UN agencies and conventions working together to solve the e-waste problem, and each bring their little piece of the puzzle. So there's a lot of work going on, and we really need to make sure that this actually gets translated into solutions. We have a lot of resolutions at the World Health Organization, not directly on electronic waste, but on things that relate to electronic waste. I have listed a few here. you know, either on environment, on climate, and also on chemicals, you know. And so this also called for us to be working on this kind of issues, you know. So our ministers of health do have a mandate to work on these toxic chemicals. We have an initiative in WHO on electronic waste and child health to accumulate evidence so we can tell the world about the real problem, raise awareness, build capacities, do trainings. We have a training now with UNICEF and also training materials, PowerPoint materials in the World Health Organization that you can all have and use as PowerPoints to train others on electronic waste and child health. They're in our website, which will be in the final slide, and also a training course with UNICEF on children's environmental health. So, you know, a lot of the problems that children face in terms of the environment, and there is a section on electronic waste. We have this MOOC. This MOOC is really important because this MOOC allows everyone to understand what the different actors can do about electronic waste. So I really encourage everyone to take it. Anyway, in our initiative, we also promote for, you know, right indicators, multi-sectoral policies. And as I said, we also have a lot of information and materials on the different components of e-waste. Mercury, lead, we have guidelines for managing lead. And this is International Lead Prevention, Lead Poisoning Prevention Week. So if you go to our website in the World Health Organization, you can follow, you can enroll, you can promote a lot of lead activities this week. You can raise awareness, you have materials. And even if it's not this week, you can use them, you can contact us, and we can help you promote, this issue at country level, so we can decrease our children's exposure to lead. Thank you very much. So yeah, there's other tools here, and I think this presentation will be shared anyway. So yeah, here's the website to the e-waste side, but all WHO e-waste side, but more specifically to the MOOC. And I invite you all to go to the MOOC and to find out more about child health, much more than we discussed today, and how it's affected by electronic waste, but also about what everyone can do so that we can solve this problem together. Thank you very much. Over to you, Francesca.
Thank you. Thank you so much, Marie-Noël, for this very encompassing presentation, and also the links to the materials and the support to the action, because this is at the basis of the MOOC. It's trying to support people to take action. So now we open the floor and we take advantage of this great expert today with us. And I invite you to pose questions to her. You have different possibilities. You can open the Q&A window, or you can send the questions through the chat. Just remember, if you want to speak, you can also speak and ask a question, to raise your hand and to lower it when you have finished. You will find the raise hand in the menu react with the heart. And when you're given the floor, remember to unmute your microphone and to mute it again at the end of the question. And we will monitor both the chat and the Q&A to see if you have decided to write your question. So I open the floor to the questions and answers. Really take advantage of the presence of Marie-Noël. It's very, very precious and very important. So I don't know if you have. We see. Thank you, Ms. Brun, for the impressive presentation from Adelaide, Gartili, and many thank yous. I have this question, which is I think about the future and what is going to happen on chemicals in WHO, and many of these chemicals under the radar, which are new chemicals, for which we start to know more about their effects on health, on human health. So which are the chemicals you'll be working on in the future in WHO, and what is the main area of work? Of course, you have already introduced lead, but perhaps you can tell us more about lead and the other chemicals.
Thank you very much. Yes, I think we in WHO we did at some stage a list of the 10 big public. Thank you so much, and thank you, Adelaide, for your nice comment. We did in WHO at some stage a list of the 10 chemicals of concern, or 10 areas of chemicals of concern, and I think, you know, when they included pesticides, air pollution, lead, mercury, POPs, persistent organic pollutants, and you know, as we were saying with lead earlier on, you know, a lot of the legacy chemicals that we have in the world, and you know, things like mercury, we are still working on. We still have work to do. It's a lot of the chemicals are used in such different ways in so many different parts, you know, in different parts of the world, and so you know, lead, for example, we find it in here. We find it in electronic waste. We have this huge campaign for eliminating lead out of paint, and a lot of countries are now starting to sign these laws, for example, for getting lead out of paint. But we still have a huge legacy problem of lead in mining, and also lead in all paintings. You know, we've been painting all our buildings up to now with lead, and all of that, you know, as we renovate or something, it gets volatilized, and we are exposed to all of that. And the same with mercury, for example. We still have a lot of mercury problems. There's still a lot of places in the world where they use mercury to whiten their skin, you know, to use, and so that's very culturally specific. I find it quite interesting because we work in the same team as the people working on radiation, and the people working on radiation are trying to ban or to reduce as much as we can the use of UV sunbeds, you know, because on other parts of the world, people want darker skin. And so, you know, they're exposed to this hazardous radiation. So we still have a lot of these legacy problems that we are working on, and these legacy chemicals that we are working on. And so the work on them continues. Pesticides is still a huge issue in most parts of the world. The different pesticides we're exposed to, and often the problem with chemicals is we replace one chemical with another one we have less information on. So, you know, we can never give up the chemical area, the chemical fight in a way. And at the same time, we are also working on the information that's new. Right now, we're working on the new WHO and United Nations Environment Program report on endocrine disrupting chemicals, to see what is the state of the science today on endocrine disrupting chemicals. And these are special chemicals because these act at very low doses or at low doses and may have an impact differently. So we are still working a little bit. There's a lot of work on plastics, of course, because there's a lot of call for work. Actually, what we do in WHO is mostly we respond to what the ministers of health ask us to do, because they are the ones who govern us. But there's still a little bit, as I said, there's the legacy problems that we still have to work on, because the fact that the legacy doesn't make them less toxic. And there's the new ones that we are juggling as they come up. Thank you so much, Francesca.
Thank you to you for this very encompassing answer. And I will now pass the floor to Ravichandran Birappa. I don't know if I pronounced correctly, but please take the floor. I see you are muted. Yes, we can hear you.
Yeah, 1 minute. Hello.
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 Hello. Good afternoon.
Good afternoon.
Yeah. Is there any studies on the PCBs among children, those working at recycling work sites? We have all these, we found only lead or some certain heavy metals only, but a lot of organic pollutants also we could observe. Is there any studies by WHO?
Yes, we definitely, I mentioned them more generally as POPs, as persistent organic pollutants, but definitely there's a lot of PCBs. Unfortunately, those are still also, even though they've been banned in many places, they're still around. So yes, so when we did when we did our report has over 100 pages in WHO. It's called Children in Digital Dump Sites. And we looked at all the different, I often use lead because it's the one where we have a lot of information and it's very easy to illustrate and, to an audience. But definitely there's a lot of persistent organic pollutants. There's a lot of toxicants, as I said, over 1,000 at least very highly toxic materials, as well as, some very valuable materials. So if you look at our report, you will see a breakdown of all of those, and PCBs is most definitely there. And this being, this persisting in the environment, and also, you find them again in food and in many places. There's actually, there's reports for some of these chemicals. There's reports, for example, in Ghana, in one of the towns of Ghana, where one egg exceed the cancer limits, daily cancer limits, about, I don't know how many, tens of times, the WHO recommends. So you eat one single egg and you've already, exceeded the cancer limits in food that you can have per day of like tens of times. So there's a lot of different chemicals we could illustrate this with. So again, I invite you to, to go to the training materials in the smoke, and also, the ones that we have in WHO, and there we go much more in depth into all the different kinds of chemicals and helping. Thank you, Ravichandran.
Thank you. Thank you.
Thank you very much. We have another question from Adelaide Gatili. In your view, what is the key barrier or lever that needs to be addressed today to improve electronic waste management? Do you believe in the lies in manufacturers' willingness to change their practices, policymakers' commitment to prioritizing this issue, or perhaps another factor? Overall, how would you assess the level of genuine attention to this problem that this problem receives from both industrial and political stakeholders? Wow, this is a very important question.
But I can only speak for health. For health, what we do is we want to make sure that the information is out there. So no one can tell us, we didn't know, or this information was not available. So what we really want to do, and we really want to show the impact this has on health, and on the health of children. And this is really important, because I think this really moves. Then we don't have, in WHO, we cannot bind people. We can only put out the information. We can give the best of information, but we cannot make people do something. So we cannot really make manufacturers. I know, because I've seen this in other initiatives that we have, that they usually follow what we do quite closely, because they always find a way to market what they do, in a way that, when you say something is bad, maybe they will find a replacement or something else. And then, we saw it with bisphenol A, for example. The moment that the health community started, giving out all these studies about bisphenol A, then you had the industry putting out all these bisphenol A free things, which in a way didn't necessarily mean they were healthier, because often they were replaced with other bisphenols, but they usually listen. But we as WHO can only, put out our information and try to make sure that at country level and at, at different levels, we can generate as much momentum and as much action as possible, and then it's lobbying things. Yeah. And that's ultimately why we're also working with you, in Basel conventions and in other conventions and in other agencies, because you guys have the power to actually change more the policy sides and yeah.
Thank you, Marie-Noël. And there is another question from Adija Alidu. Thank you, Maria and Francesca, for this wonderful session. I'm Adija, and I work for Upcyclers, a startup in e-waste management based in Ghana, on the topic of child labor and their involvement with e-waste. Sometimes educating parents on the danger doesn't cut it. For us in the north, children go around to collect e-waste for local recyclers. And what are other practical solutions that we can suggest to them to prevent children and their involvement?
Yeah, we learn a lot of our lessons from Ghana. I think it's all about, again, it's all about talking to the parents. I think one of the things that has, that has proven, to be the most effective is for these things not to happen in the homes, and to find really a place for it to happen in the community where there's certain measures of protection, so community workshops instead of having home workshops. I think probably home workshops are the most hazardous places, because there is no protection there. And, you know, for a child, it's like they can play with everything and they're exposed to everything. So at least in a community workshop, you can also work with that community to make sure that there's certain elements of protections and things are done a certain way. But I think, you know, again, talking to the parents, you know, and I think as a healthcare worker, you have that authority and that respect, you know, in which the parents will listen to you, because everyone wants the best for their children. But yes, so that would probably, for me, in things, something like, again, I will say lead, but you know, some of these chemicals are so highly toxic that the only solution is get the child away. The child has to be removed from that exposure. So whatever it takes, get the child away.
Thank you so much for this answer. I also would like to share on this important theme of lead in children that we are developing under the Basel Convention, the technical guidelines on the environmentally sound management of waste lead-acid batteries. And lead, the use of lead is mostly due to its use in lead-acid batteries in the world. So some figures speak about 80% of the lead produced goes into lead-acid batteries, and in qualifying the practices which are acceptable. Also, the global community under the Basel Convention stated that children should not be even close to waste lead-acid batteries. They shouldn't be touched. They should be far away from them, where they are dismantled and where they are recycled. So this is a very important message that is also reflected now in the Basel technical guidelines, and is a strong message, but is really motivated by the new evidence on the IQ effects of lead, especially on children. So I want to just highlight this point. And I don't see any other questions. And our time is also over. So I take this opportunity to really thank Marie-Noël for this great presentation and for her answers. And I really invite all of you to check the WHO website and to take the MOOC, the course 2 on e-waste and children health. And I thank you for this, and I will reassure you that you will receive the presentation and the recording on your email. As you know, this webinar is part of a series, and the webinars continue. This week we have another session in Spanish on 23rd of October on Thursday at 3 p.m., which focuses on reducing e-waste by design, policies and standards and businesses. And the session will be in Spanish and presented by the ITU. And I wanted to thank Artem, who helped us today for this session. And I want to thank all of you, the participants, and I hope to see you in the next sessions in the coming weeks. I thank again Marie-Noël for immense work in this area and for her work in general. So thank you so much. Thank you to all. And we close the session now. Bye-bye.